We are MyData4Pandemic. This is an initiative of MyData Global, an international nonprofit organization founded in 2018 with over 600 members, including over 90 organizations from over 50 countries on 6 continents. Its mission is to empower individuals by improving their right to self-determination for their personal data. In MyData4Pandemic, we outline a framework for a responsible and citizen-centric management of the COVID-19 pandemic. By empowering individuals to share their data in trust, it is possible to optimize prevention and maximize mobility to limit the negative impacts of the pandemic. As of July 21st, 2020, the coronavirus outbreak has lasted for 7 months. At a global level, there are no signs that we are in control. The impacts on health, the economy, and on education are massive. Medical treatment has had limited impact. While there is hope for vaccines by early 2021, there is no certainty that immunity will last more than a few months. At a public level, people have been confined at home for weeks. Social distancing measures were enacted, with testing to identify positive cases. Digital applications have been deployed in different countries, including contact and location tracing, status tracking, verified credentials with test results. One of the main concerns is whether these solutions respect the individual right to data privacy. Do we trade basic human rights in the name of public good? These digital solutions are fragmented, while we need integrated data to support effective decision-making. So, what do we need to do next? Most importantly, what do we need to do differently? Taking population-wide measures is not sustainable. We need to be adaptive to a constantly evolving context, and for this, policymakers need data. Individuals need to decide what personal information they will contribute. This personal information needs to be exchanged in an interoperable format to enable sharing across countries. MyData4Pandemic is based on the premise that data covering a wide population requires 3 components. First, digital solutions that collect individual data with proper permissions. Next, trust from individuals by empowering them to decide which data to share, for what purpose, and for what period of time, to give them full data control. And then finally, interoperable data commons based on agreed international standards such as the HL7 FHIR. In a MyData4Pandemic platform, individuals are at the point of integration. Data are controlled by the individual and not for the individual. The envisioned platform would include data sharing mechanisms across different stakeholders, supported through decentralized identity, as well as governance grounded in MyData principles to enable trust and platform adoption. Individuals are fully empowered to control their data through 3 capabilities. A control panel from where they can manage their data across different sources. An intelligent assistant that can automate mundane tasks. And a digital wallet that includes a mobility and health score continuously updated based on evolving context. These 3 capabilities put individuals truly at the point of integration and enable them to contribute to the population data commons. Within the MyData4Pandemic platform, individuals can control integration of their data from different sources into their data profile, as well as integration of their individual profile into the population data commons. From the data commons, the platform can then derive insights and perform strategic segmentations, enabling authorities to take appropriate adaptive measures 4 discrete parts of the population. The data commons also enables regular updates to individuals' reports and mobility scores. The MyData4Pandemic platform will be successful. That is, widely accepted if it relies on trust derived from governance. This is grounded from 6 MyData principles. These principles can be verified by individuals through a set of checklists available through the platform. The question is not if there is going to be a second wave of COVID-19, but how to minimize it and manage it effectively when it happens. This requires integration and sharing of relevant personal data coming from different channels. We respect the right to privacy and give individuals control of their information. It's our belief that even in a global crisis, the interest of both public health and basic human rights can be achieved at the same time. To engage with the MyData Global community and the various initiatives, please go to the channels listed below.